South African Medical Association is calling for the establishment of specialized medical courts. Now, the call comes in the wake of the murder charges leveled against pediatrician, that's a pediatric surgeon, Peter Beale. Dr. Beale is accused of unlawfully and intentionally causing the deaths of 3 children after he operated on them. Well, the South African Medical Association says the case has created a dangerous precedent. Let's talk more now on this, and we're joined by Dr. Mark Human, Chair of SAMA's Human Rights, Law and Ethics Committee. Dr. Human, thank you very much for your time. It's quite a sensitive story, this one. Dr. Peter Beale, accused of unlawfully and intentionally causing the deaths of 3 children after he operated on them. For viewers who may not be familiar with this case, take us back a few steps. What actually happened?
Good morning, Polly, and good morning to all your viewers. Thanks for hosting me. To cut a very long story short, there was an adverse event following a surgery in a 10-year-old boy, a young Master Syed, which very unfortunately resulted in his death in the immediate post-operative phase. I can't really talk about the specifics of the case, but initially the surgeon was charged with manslaughter, culpable homicide sort of thing, and now those charges have been elevated to murder. Now, I understand murder presupposes some degree of intent. So what they're saying is this highly decorated, extremely skilled pediatric surgeon, professor of pediatric surgery, winner of the Minister of Health's Medal for Services to South Africa's Children, that he actually intentionally went to work one day and decided to kill a 10-year-old child. That's just beyond absurd. So how a charge of murder gets leveled is really, it shows you the level of disconnect between the MPA, clearly good at prosecuting or not, certain crimes, but when they get reported this as a crime, they do not begin to understand all the intricacies involved. Now, of course, one of the problems with any of these kind of medical issues is that they are hugely complex issues. There are many, many factors that go in. It's not just the one action of one surgeon or his anaesthetist. It's the hospital environment, the recovery room, the equipment available, the nursing staff. There are so many things.
Yeah.
Yet there is no process that properly examines all of those things together to see where the flaws were, to see how we can solve them and not make the same mistakes again. Our whole system is based on the American tort law system, which immediately looks for someone to blame, and that person is automatically the person who you can most easily extrapolate funds from. And this is a huge cost driver in our medico legal industry in South Africa, where basically doctors are forced to spend huge amounts of money every month to insure themselves against these cases that often settle out of court without even getting to the bottom of where the problem lies.
Yeah.
The family are not receiving the compensation because half of it goes to the law firms and so on, and there are huge time delays. So right from the very beginning, the family, the plaintiff, the person that was injured doesn't get what they really want. Then putting doctors in jail because they made a mistake, that's going to really solve our problem. We already have so few doctors in this country, massive shortage of doctors, made worse by the recent brain drain and departure of specialists and so on. Now we're going to make it worse by putting them in jail. How is that honestly going to solve the problem?
Yeah.
I mean, technically, the minute you cut someone for an operation, that's an assault. But the law suspends the normal treatment of that assault because by mutual consent, the patient and the doctor agree that this is in the interest of the greater good. So you don't charge every surgeon after every operation with assaulting the patient. And this is one of the reasons why we need specialized courts, so that they can work these things out.
Dr. Human,
we need the whole...
Dr. Human, I'm sorry to interrupt you there. I want for us to have... to take the viewer along. And so you've given this background. How did the charges actually come about? You mentioned that at first it was manslaughter. That's
yes.
The U.S. term for what our term is What's the
Culpable
charge?
homicide.
Culpable
Yes.
homicide, yes. And now that's now
So
been
charges
upgraded
really late.
to murder, yes. So I want to
Yes.
know how the charges came about. Did the parents of these children go and complain?
So I cannot give you the exact specifics of that, but the way that a criminal charge originates is that someone has to lay a criminal charge. Now, the way things normally work after an adverse medical event, which unfortunately happen much more often than we would like to believe, but it's about what happens afterwards. What normally happens is that there's a professional inquiry. That is meant to be handled by the Health Professionals Council, but they have been very dysfunctional recently, and they haven't given the patients and their relatives the answer that they need. Most often at SAMA, we are seeing that these people really just want to know what happened. What happened to my child? How did he die? What led to this? They want answers.
Yeah.
And of course, compensation does come into it, especially when someone has lost a relative or having a long-term injury. There needs to be some kind of degree of compensation. When a cerebral palsy child is born, there needs to be some mechanism to look after that child and to create those funds. But our current system's a disaster. We don't have mediation, which is what we should have compulsory for any adverse medical event. That should be the starting point.
Yeah.
And then we should move from there. But frustrated relatives, frustrated by the dysfunctionality at the HPCSA, are looking for some kind of compense, and so they go and lay criminal charges, or they lay civil charges. There are three processes that are independent but can take place all at the same time.
Let me ask this
So that's
question.
how the criminal charges.
Let me ask this question
again?
because I'm saying I'd like to follow up with this question because interestingly, in the story, or at least the article that I have been reading from, where Dr. Mzugwa, who is the chair of the organization that you belong to, SAMA, the understanding is that the doctor in question, Dr. Peter Beale, has voluntarily removed his name from the Health Professions Council. You've already mentioned that there is quote-unquote dysfunction there, to use your words. Why did he go through this step of removing his name from the register of the Health Professions Council?
I think you need to contextualize this. Professor Beale is towards the end of a career. He's in his early 70s, and he was already at the point where handling these very high-risk cases and so on, he did not need to work for money. So saying that this was done for money is absolutely absurd. He was at the tail end of his career. Now he gets charged first with culpable homicide. Then those charges rather bizarrely get elevated to murder. And this is dragged on. It's already over 3 years now, and it's going to be 4 years by the time this case gets heard. He was at retirement age, and his lawyers said to him, it would probably be a good idea that you voluntarily remove your name from the register at this point. You're not going to be practicing. There's no point in paying licensing fees every year further on. And, of course, you don't erase any actions that you have done in the past. Those can still be brought to bear. But you don't need to be licensed as a doctor anymore if you're not able to practice and if you don't want to practice.
Yeah.
Of course, there may be people well before retirement age who may make similar decisions because their work becomes untenable. If you suddenly are going to work thinking, I might land up in jail because I'm trying to help this person, be it that I make a mistake or that it's a systemic error and a whole bunch of things add up that result in a negative outcome, I might be the one that lands up in jail from this. That's not going to make doctors want to do their jobs.
And on that point, there is a mention that this is going to discourage young doctors who want to become specialists, or even attracting doctors into this field. Let's then plot the way forward, Dr. Human. When you say there must be special medical courts that are established, what do you think this will resolve?
You see, as I said, these things are hugely complex issues, and examining any one piece of the puzzle is exactly like that. It's examining one piece of a puzzle where you will not understand how the whole error came about in the first place. And sometimes it's very simple and straightforward. But most of the time, like aviation, I'm sure you've heard of the Swiss cheese phenomenon. It's like those holes in a block of Emmentaler, where each hole represents a little mistake. And it's typically when 4 or 5 mistakes happen all on top of each other that a major adverse event happens. And in medicine, it's exactly the same as that. It's multiple errors. And you can't examine the doctor or the nurse or the theatre or the recovery room or the equipment available or the hospital chain in isolation. You've got to examine them all together. And this needs to be done by a qualified panel of experts who properly understand these things. Trying to educate a magistrate on the ins and outs of medical treatments about which there are already a whole lot of controversies is impossible.
Yeah. And finally, Doctor, the reason for this call, you are sounding, it makes sense from what you are saying, but is it finding expression, though, where this call ought to be made, and that's to lawmakers? Where are you as far as that?
At SAMA, we have been trying and failing to convene, for lack of a better name, a medico-legal bosberaad, which is a meeting between the NPA, the medical insurers, the medical industry, the doctors themselves, the health minister. All of these people need to come together and find a way forward. The South African Law Reform Commission has for years at a glacial pace been working on recommendations to fix our broken medico-legal system. And at the moment, it's still just that. They haven't even published the final recommendation document, although there is a lot of valid stuff in there already. They're going through the engagement process. But this needs to be accelerated. And certainly, charging doctors with murder or prosecuting people and putting them in jail, that's not going to solve the problem.
Dr. Mark Human, thank you very much for putting us into the picture here. It's quite a sensitive topic indeed. And let's leave the conversation there. Chair of SAMA's Human Rights, Law and Ethics Committee.